was called to see a patient in one of the big private hospitals on the island. Young lady wished for other things and spent so much money before we got around to saying this is not cancer, this is not a bacterial infection, this is not TB, but this is a fungal infection.
That story, told by Dr. Rita Oladele of the Mycology Department at LUTH, represents the cases of many Nigerians who die of invasive fungal infectious diseases every day due to lack of relevant facilities to diagnose them.
The earlier you make the diagnosis, the more likely they will survive, the better the outcome. And in fact, for things like invasive aspergillosis, candidemia, literature says that for every day you delay starting treatment, you increase the risk of that patient dying by 20%.
Another major challenge is the inability of many clinicians to identify these diseases, which has necessitated calls for capacity building.
The way forward is for the government to equip our labs. We need to, in this whole country of about 200 million people, there's not a single reference mycology lab. We don't even have trained clinical mycologists.
Training and retraining of medical personnel, that's even the most important thing. If a doctor does not know about fungus, he cannot diagnose it. And since there's nothing that is striking about the presentation, you have to be thinking it to say, this thing as well, thinking it is tumor. Please, let's put it behind our mind that it can also be fungus so that we can pick it up early. People, the most important thing is they have to avoid damp places. Some people live in houses that are waterlogged. After the rain, the water, fungus likes wet dampness. He likes it. And then some people live in areas where they cannot open their windows. And then the whole thing circulates right inside. So like we said, if the mold is in the air, if it is high, then you breathe it in a lot. And then if the immunity, that's why they're talking about HIV, cannot control that, then it becomes a disease. If no, fungus lives in the body as normal commensal. It doesn't cause disease. But either the quantity increases or the immunity reduces of the host, then it will cause disease. So environment is very important where we live and where we work or all that. How damp is it? A good ventilation. Sometimes they are in the vents of the AC. So as that AC is blowing in an enclosure, it just keeps circulating it around. That's why vents have to also be cleaned. That's for the individual. That's why they're talking about where there are a lot of dust, sawdust. And even when they were talking, I remember these people that sell beans. Inside that, some have stayed for a long time before coming. There are mold in it, and all that. Even in the banks, you see people covering their nose when they are counting money because some of those notes have fungus on them. And if they expose themselves to it, they will breathe it in and it will form this condition we're talking about. For government, they need to bring down the cost, subsidize the cost. Like the drug we're talking about, voriconazole, is about 70-something thousand naira for 2 weeks dose. And they need to take it for 2 years. And we're not talking about the surgeries. You heard the neurosurgery say he will do multiple. I will do multiple as well. So those multiple surgery with the drug, 78,000 as at the last time I know, for 2 weeks dose, for 2 years. How much is that person making to afford it? So the drug is expensive. We need to get it down. Government needs to subsidize the treatment of fungus. But it's a treatable condition if we get it early and if we follow it up. But I'll tell you, most of my patients, we've never followed up because when their money is exhausted, they stop coming.
Most people who take antibiotics for typhoid don't really have typhoid. And when they have abused some of these antibiotics and taken them for so long, they are now predisposed to these infections that we're talking about, fungal infections. So instead of somebody running to the lab and say, I went to do a test and I had typhoid and malaria, I think the person should get to a teaching hospital and be properly evaluated. We are saying to colleagues, we are saying to patients, we are saying to people all around, if you see something that is affecting you. Somebody is bleeding from the nose, somebody is having nasal blockage all the time, and you really have treated and you are not sure of what it is, and this nasal blockage seems to be worrisome and keeps recurring, it's time you get to a proper person. Get to an ENT surgeon, let them review you.
Once an individual has HIV infection, that peripheral cells of immunity that we call CD4 cell positive cell, or what other people call T helper cell, it kills that cell, and then all the immune functions are in disarray. And that is what we are saying, that if an individual is HIV infected and the level of the CD4 positive cells becomes very low, then you are exposed to a lot of infectious agents, including the fungi, the bacteria. So when we bring the HIV drug to you and the level of the virus go down and your immunity wakes up, that waking up of immunity may now find a lot of these fungal antigens in you, may find a lot of this bacteria antigen in you. So that's what we call antigen-antibody reaction, or what we call immune complexes. And those immune complexes can now even damage your organ. So you have given a drug to eliminate the virus, and you are now ending up with another type of disease. So what we are saying now in the entity advanced HIV disease is that if you detect somebody who is now newly HIV diagnosed, before you begin to give treatment, please find out whether the disease is advanced. Because if the disease is advanced, it's more likely to have deep-seated fungal infection. It's likely to have deep-seated tuberculosis infection. So if you bring the HIV drug and the immunity wakes up rapidly, then immune complex disease may kill that individual.
The Fungal Disease Awareness Week is celebrated globally from the 23rd to 27th of September every year to increase awareness about invasive fungal infections. The theme for the 2019 celebration is Think Fungus.